Hello, I am Dr. Farshad Amini Behbani and this is short course of Iranian traditional medicine. In this section we discuss about the pulse. Pulsology or sphygmology is one of the diagnostic way in Iranian traditional medicine. Pulse is the movement of the arteries or the container of the spirit. Pulse, like other phenomena, can be described by Aristotelian logic, by the four causes of the Aristotelian logic. In formal cause, we have a movement contained of two I mean expansion and contraction, or ascending movement and descending movement of pulse, and two stillness, peripheral stillness between ascending part and next descending part, and central stillness between descending movement of previous pulse, and ascending movement of the next pulse. In material cause, we have artery wall, artery lumen, and blood in the artery, the spirit that flow in the artery, or wind that is besides the spirit in the artery. We have meat and skin that cover the artery that can affect on the pulse, and we have the heart as material causes of the pulse. The situation of this component, the temperament of this component can affect on the pulse. And in efficient cause, we have vital force as the main force of pulsation. We simply called it the force. The final cause that we simply call it the need is to cooling the spirit by fresh air in expansion movement of the pulse, and to expel the unnecessary vapors and smokes from the artery and from the spirit, which is flowing in the artery beside the blood. So if the need increase, for example, if we need more cooling in fever, the expansion part of the pulse should be stronger and faster than the usual. And if we need to expel more vapor, more smoke, for example, in the infection, the descending part or contraction should be down, faster and stronger. There are some difference between pulse sensation or pulse diagnosis in Iranian traditional medicine and other schools of medicine. In Iranian traditional medicine, what is important is the movement itself, and interpretation of the movement for evaluating mostly the heart position. But in other schools of traditional medicine like Ayurveda or Chinese medicine, they search for detection of the spirits in the artery. I mean the spirits of the main organs. In Iranian traditional medicine, we try to eliminate the difference between sensitivity of the fingers. So we put less sensitive finger on most prominent part of the pulse. I mean the part that artery pass on the styloid process of the radius bone near the thumbs of the patient, and put the most sensitive finger, I mean the index finger, near the elbow, because the artery is covered with meat and some tissue more than the wrist area in this part. So the difference between sensitivity of the four fingers somehow become neutral or become less. And we use our sensitive hand, I mean right hand, for detecting the pulse of the patient's right hand, because right hand is farther from the heart, and the pulse is weaker compared to the left hand that is near the heart. And we used our less sensitive hand, I mean the left hand, for detecting the left hand of the patient, because the left hand of the patient is near the heart and the pulse is more obvious. And of course, we try to eliminate the effect of the gravity and effect of the traction of the wrist. If we examine the hand of the patient in supine position, there are some traction because the position of the hand on the wrist, and the artery will be tracted more, that can affect on pulse sensation. The length will be more in this sensation and artery become narrower. And we prevent to examine the pulse of the patient in supine position, because in this position the artery is hanging and it is short in its length and it's more prominent in its height. So we evaluate the hand of the patient in lateral position. The thumb is above. In this position, the arteries suffer less traction or less hanging. We hold the hand of the patient with our opposite hand. For example, I hold the right hand with my left hand. My fingertips of the left hand touch the palmar side of the patient, and I simultaneously, at the same time that I detect the pulse, I feel the amount of warmness of the palm hand that is important in detecting some fever, some hiding fever, I mean the thin fever. And I evaluate the amount of sweating of the patient at the same time, and I prevent the contraction of the muscle of the hand of the patient that can affect on the pulse. We somehow lose the hand of the patient. You can feel if the hand of the patient is contracted, and you can notice or tell the patient to lose his or her hand for examination. The patient in this position should be relaxed, completely in front of you, not twisting in any side, and patient and healer should be free of psychotic feeling. The pulse is better to examine after taking history and after confidence of the patient to the healer and after calming. You should ask permission from the patient to detect his or her pulse. And it is better that pulse detection not be rapid after mealing or on an empty stomach, because they affect on pulse. It is better that not detected the pulse be not detected after bathing, after shower, because it can affect on the pulse. I explain the component of the pulse in the next section, but the most important thing in pulse detection in Iranian traditional medicine is to determine the pressure that you examine the pulse. For reaching to this pressure, put your forefinger on the artery, on the radial artery. This is the easiest artery for examination of the pulse because it is not covered with too much meat or fat, and it is easy for patient to show it to you as a healer, and it can easily hold at the heart level with an elbow, with an 9-degree elbow. You can examine the pulse without hanging of the pulse or without losing of the hand. So after putting your fingertips on the radius artery, not so tight, not so wide and distant from each other, simply loose beside each other fingers, press the artery until the pulse cut or disappear, and then slowly loose your fingertip to feel the first beat and hold it. Hold the finger at that pressure. This is the pressure that you will examine the pulse components in next section.